a 3-inch casting material. I'm going to show you how to make a serial cast. And you're going to use serial casting to increase PIP extension. And so it works really well for people who have long-standing contractures like a boutonniere deformity, or I actually corrected a little girl who had a congenital loss of PIP extension, and she came in because she couldn't play her clarinet, and we were able to actually get her enough extension with the serial cast after a lifetime. I mean, she's like 10 years old, and so it works amazingly well. So what you're going to do is I use a 3-inch material. The 1 inch is a little bit too narrow, 2 inches too wide. So what I do is I take a 3-inch and cut it in half. So you want to cut strips that are a little piece of cotton, or cotton ball, but a little piece of a cotton ball. If you have web roll padding, you can cut a circle of padding over the PIP joint, just so there's a little bit of something over the PIP, but you don't wrap the whole finger. So the casting material is going to go directly on the skin, except for at the PIP joint. And I talked about the removable cast. If you are making a removable cast, you would dip the finger 1 time in paraffin wax, and then you do not use the cotton padding over the PIP joint with the removable cast. And generally, by the time you're making a removable cast, you've gotten some correction, and so they're not in as much flexion where they're likely to get a pressure point over the PIP. So you take your strip of casting material, dip it very quickly in the water, and then you start to squeeze it out so you get rid of a lot of the moisture. And then unwrap it. I fold over that jagged edge, and that's going to be the edge of my splint, so it's nice and strong. And then I'm going to wrap it over the DIP joint, because if you don't include the DIP, you really don't have enough length to effectively control the PIP. And then I just spiral it down the finger. And then I take my next piece, dip it quick, bring it out. Oops. And then again, that jagged edge, fold it down, and this is going to go on the bottom. So I do this right above the proximal finger crease. Go ahead and bend your finger a little bit like you have a contracture. And so depending upon the size of the patient's finger is going to determine how many strips you use. So she's pretty small, so I'll probably use 4, maybe 5 on her. Now it's not as important if I'm not doing the edge to bend that, but I'm going to do it anyway, just so it's neater. And then wrap. And you kind of smooth it down as you go. Now, your patient may initially feel some throbbing of the finger just as their circulation is used to the confines of the cast. But I do oftentimes have the patients sit around in the clinic or go for a bite to eat and come back to just check the color of the fingertip. Initially, they may turn a little bit red when you first put the cast on. But usually within about 15 minutes, they kind of adjust to it and things are fine. If the fingertip looks dark red or bluish in color, then you've wrapped it too tight. I'm not pulling this at all as joint. And so I'm pressing there on the distal phalanx, right at the DIP joint line, and then over the PIP and proximal phalanx. And I just sit there and hold that until the casting material sets up. And you're going to press a little bit because when you let go down here and here, it's gonna release some of the tension. So you want to kind of stretch so they feel a little bit of discomfort, not pain, but a little bit of discomfort. And then when you let it go, it should be just fine. And it doesn't sessions. So again, the original protocol called for changing the cast every other day, but more recent studies are showing that leaving it on for a week, you get the same benefits as daily or every other day cast changes. Any questions? Okay, thank you.